morning or afternoon if it is where you are to everyone, and thank you for being here. My name is Toni Appelberg-Parks. For anyone who doesn't know me, I lead our Medicare risk adjustment and clinical documentation program. And today I want to talk to you about something that sits right at the intersection of what we do every day and where healthcare is headed. So that would be the future of coding in a world that increasingly is running on artificial intelligence. There's a lot of noise out there about AI replacing coders or making our skills obsolete. So my goal in this session is to cut through some of that noise and talk honestly about what is changing, what is not changing, and where the real opportunities are for people who understand coding, documentation, and risk adjustment. So by the end of this presentation, I want you to feel informed, a little more confident, and maybe a little bit excited about how your role can evolve as AI becomes part of our day-to-day workflows. So here's where we're going over the next 20 minutes or so. Mainly, we want to understand what the role of AI is and why it matters in coding, starting with where we are today, how it's being used right now, industry-wide, not just us, and what kind of opportunities are out there for coders and organizations in the utilization of AI. What kind of risks and pitfalls should we avoid, and how you need to skill up going forward to be prepared for this. So what you can start with today and what needs to happen moving forward. So let's start with the simple question. Why does AI matter in coding at all? Every year we see more documentation, more encounters, more chronic conditions, and more complexity in the coding rules themselves.
Sometimes the volume of work is just overwhelming.
We've got evolving HCC models, updates to ICD-10-CM, payer-specific rules, and all the usual regulatory changes.
Sometimes it's just the constant changing guidelines and coding rules that are overwhelming.
Trying to manage all of that with purely manual processes can feel like trying to bail water with a teaspoon.
How about you? Have you ever felt like this?
And at the same time, the pressure is on from the other side. We have payers increasing their scrutiny, payers and CMS, more audits, more takebacks, and constant expectation that we turn charts around quickly without sacrificing accuracy. AI and automation matter in this environment because they give us the tools to handle volume and complexity, hopefully without burning out the team. If we use them wisely, they can take some of the routine, repetitive work off of our plates so that coders can spend more time on the things that truly require judgment, things like complex cases, documentation improvement, risk adjustment strategy, and education. So if we're honest, the day-to-day reality of coding and CDI is not really getting simpler. Most teams, not just ours, are dealing with high chart volumes and short turnaround expectations. When you add in new models like updated HCC versions or payer-specific risk programs, coders are constantly trying to keep guidelines straight while the ground shifts under their feet. On top of that, denials and audits are a constant concern. A few misdiagnoses or a pattern of documentation that doesn't clearly support severity can translate into real dollars lost and red flags from payers. That creates stress, not just for leadership, but for the coding team who might feel like everything they do is under a microscope. So all of that together can set the stage for burnout. So when your job is high volume, high complexity, and high scrutiny all at once, it is easy to feel worn down, and so important to care for yourself and do the things that help you unwind at the end of the day. This is the environment, though, that AI is stepping into, not to magically fix everything, but to help us work in a more sustainable way. When I say AI in coding, I'm not talking about some sci-fi robot sitting at a desk doing your job. In practical terms, AI usually shows up as NLP, natural language processing, that reads provider notes and tries to understand what is being said. On top of that, you have algorithms that map those concepts to possible ICD-10 CM and CPT or HCPCS codes, or that flag the potential HCC opportunities. In many organizations, AI is used to handle the simpler, more repetitive cases. Think straightforward encounters where documentation is clean and the logic is pretty clear. Those can be auto-coded or at least pre-coded for a human to review. My vision is for us to see more AI is to see us more AI assisted, especially when and if we start to participate in commercial risk, because then you're dealing with all the different payer rules and things like that. Um, so I embrace the assistance that we can achieve with AI, but it is there is a learning curve and it does change our workflow. But the coder's role doesn't disappear in this world, it just shifts. So we become the validators, the editors, the people who know when the suggestion is right and when it's wrong, and when the documentation needs to go back to the provider. And importantly, we're still the ones to have to be able to explain and defend the coding decisions in an audit or payer conversation. We are the subject matter experts. So, how is AI actually being used today in the real world? One common use is pre-coding. The system reads the documentation, proposes codes, and then it goes to the coder, and a coder either approves, modifies, or rejects those suggestions. That can significantly reduce the mouse clicking and hunting for codes on more routine cases. Another use is in risk adjustment, where AI tools can flag patients with potential HCCs that might not have been fully captured, similar to, the pre-charting work that we do. Maybe last year they had a diagnosis that doesn't clearly show up this year, or there are hints in the note that suggest a chronic condition that isn't coded. AI can also help identify documentation gaps. For example, where the note hints at a condition but is missing the specificity or linkage that we need for compliant coding. And on the back end, some tools help spot patterns that are likely to lead to denials or audit issues. But none of this works without human oversight. But it does help us focus our human expertise where it matters the most. So let's look at the upside, because there really is an opportunity here. When AI takes on more of the routine volume, coders can spend more time on the complex, interesting, and higher value work. So that includes complex inpatient cases for inpatient coders, of course, and really outpatient as well, maybe high risk, high chronic conditions, recent admissions, things like that. Nuanced risk adjustment scenarios and tricky documentation questions that truly require clinical and coding judgment. It does also create space for coders and CDI professionals to step more fully into education, working with providers to improve documentation, supporting quality metrics, and helping clinicians understand how what they write in the note translates into data and dollars. The same drum that I beat every single day. The documentation drives the code. Not only drives the code, it drives the compliance. And it drives the revenue ultimately. So it opens up more room for coders and CDIS to work on the education side of things and improve in these areas. As organizations adopt AI, new roles pop up too. There are people who monitor AI performance, people who own the coding analytics, people who participate in governance and strategy around automation. So those roles are natural fits for experienced coders who understand both the clinical side and the data side. So instead of just asking, will AI replace coders? A better question is, how do coders step into these higher value roles as AI takes over the repetitive tasks? Of course, there are real risks we need to keep front and center. The first is over-reliance. If we start to assume that the AI is always right, then we're in trouble. These tools can be incredibly helpful, but they're not perfect, and they absolutely do not replace the need for human judgment and compliance awareness. Secondly, AI is still limited by the quality of the documentation it sees. If the note is vague, copy-pasted, or missing key clinical details, the AI is just going to reflect that. Garbage in, garbage out still applies. And then there are also practical issues, integrating tools into the EHR, designing workable workflows, making sure the tech doesn't slow people down instead of helping them, although that's a given at first, but in the end, after an adjustment period, we want to see that it's actually helping. And we cannot ignore compliance, ethics, and privacy. We have to be sure these tools are HIPAA compliant, that we understand how they use data, and that we can defend their output. So part of our job going forward is to be a little bit skeptical and a lot intentional on how we use AI, rather than just flipping a switch and hoping for the best. So what does all this mean for you as a coder or a CDI professional? First of all, the fundamentals don't go away. Deep knowledge of coding guidelines, payer rules, and good documentation practices is still the foundation, and this is why I'm always pushing know your guidelines. Read your guidelines, memorize your guidelines. If anything, that becomes more important because you're now also validating what an AI tool is doing. Secondly, comfort with technology becomes a real differentiator. You don't have to be a programmer, but you should feel comfortable using new tools, looking at dashboards, and asking good questions about the data they produce. Third, critical thinking is huge. AI can surface patterns, but humans are still needed to recognize when something doesn't look right, or when a trend needs to be investigated, or when an exception is clinically significant. And finally, communication skills. These matter more than ever. The coder of the future isn't just in the background. They are explaining findings to providers, teaching documentation best practices, and helping leadership understand the coding and risk adjustment story behind the data. So how many of you have already worked on projects that required NLP validation? If you have, it was an extremely different workflow, wasn't it? In my experience, it was a case where the code was presented and I had to go out and usually it would point to the documentation where it was found also. So I could go right to the documentation, read through it in context, and determine whether it was a valid code or not. But it was an extremely different workflow for you, wasn't it? I know it was for me. For organizations that are starting to dip into AI, there are some practical tips that can make the journey smoother. They can start with pilots rather than the big bang. Maybe choose a focused area, maybe a specific service line or a type of encounter that is fairly standard, and test the tool there. That gives room to learn and adjust before scaling. Keeping humans in the loop is important, at least initially. Every AI-assisted chart should get a real human look, and that's how you build trust in the tool, teach the tool, and catch issues early. Tracking the right metrics like coding accuracy, HCC capture, denials, turnaround times, and coder satisfaction is important. If AI is helping, you should see these improvements in more than one of those areas. And they also shouldn't forget training and change management. Introducing AI is not just a technology project, it's really a people project. Coders need time to learn the tool, ask questions, give feedback. If we involve teams early, we're far more likely to get buy-in and good outcomes. So all of that said, there is not a planned rollout for the near future of any AI coding tools. But I want you all to understand the direction that coding is going in the future so you can be prepared to roll with the changes. And looking a little further down the road, what might the AI-enabled coding landscape look like? We'll probably see tools becoming more integrated and less like separate systems, but more like built-in parts of the EHR coding platform. They'll likely get better at understanding clinical nuance, at least in common scenarios. And as automation handles more straightforward encounters, coders will spend more time on high-risk, high-value cases, very sick patients, complex chronic conditions, areas that drive quality scores and risk adjustment. We'll also see more predictive analytics. For example, tools that tell us, here are the charts most likely to be undercoded. Here's where you have the greatest denial risk this month. All of that increases the need for governance and oversight. Someone has to own the logic, monitor performance, and make sure AI is being used ethically and effectively. That someone can very well be experienced coders and CDI professionals who understand both the clinical and the operational sides of the house. So if you're looking for growth, this is a barometer or a compass to set your direction. Since the focus of our work is in Medicare risk adjustment, I do want to zoom in there for a moment. AI is particularly attractive in HCC coding because we're always trying to make sure chronic conditions are accurately captured each year. Tools can scan across multiple years of documentation and help flag patients where the story doesn't seem complete. Maybe their diabetes severity isn't reflected, or a condition that was present in prior years doesn't show up this year. Those flags are helpful, but they're just the beginning. A human still needs to go in, review the chart, assess the clinical picture, and decide whether the documentation truly supports an HCC. That's where coders and CDI specialists come in. AI can also help highlight documentation gaps, like missing specificity or lack of linkage between diagnoses and manifestations. Then we have the opportunity to close those gaps through queries and provider education. So in risk adjustment, AI becomes a partner that helps us prioritize where to look, but it does not replace the judgment and compliance work that we bring to the table. So let's squelch this down a little. What can you actually do starting now? First, double down on your fundamentals. Make sure that your coding and documentation knowledge is solid. That's the foundation for everything else. And the foundation of your coding knowledge is your guidelines. Second, get curious. Learn about AI and NLP. Learn how the logic works at a high level. The more comfortable you are with the technology, the more valuable you become. Third, look for ways to shift into higher value work. That might mean taking on more complex cases, helping with internal audits, supporting provider education, or participating in governance around coding practices. And finally, be a voice for thoughtful ethical use of AI. Ask questions about accuracy, also about fairness and privacy. Make sure we're using these tools to enhance patient care, support providers, and strengthen our organization, not just to push more volume through the pipeline. If you do those things, you'll be well positioned, no matter how quickly the technology evolves. So, the moral of the story here, AI is no longer a future concept. It's here, and it is already starting to reshape how coding and risk adjustment work gets done. It has for a while. That doesn't mean coders are going away. It means our roles are evolving. The coders who lean into this change, who build on their strong coding and documentation foundation, and add comfort with technology and data, are the ones who will move into higher value, more strategic roles. AI is very good at volume and pattern recognition. Humans are still essential for context, judgment, ethics, and communication. The sweet spot is in a partnership, letting AI do what it does well, and stepping up as the expert who guides, validates, and explains. If we approach AI thoughtfully and proactively, the future of coding can actually be more interesting, more sustainable, and more impactful for patients and providers, not less. Thank you for spending this time with me. I truly appreciate the work you do and the way you show up for accurate, ethical, patient-centered coding every single day.